Undoubtedly, one of the hottest topics in prostate cancer today is, can we avoid extended pelvic lymph node dissection in patients who've had a PET scan that shows no avidity within the pelvic lymph nodes? I discussed this in my main plenary at the EAU in Paris recently, and it featured in many discussions in our high-risk prostate cancer session at the APCCC in Lugano. What do I think? My very clear message is that, yes, we should absolutely avoid extended pelvic lymph node dissection in patients with a negative PSMA PET CT, provided the patient and ourselves are happy to accept the limitations of PSMA PET CT. It's very important that proponents of extended lymph node dissection understand these two facts, which is, number one, pelvic lymph node dissection does not improve survival. And number two, pelvic lymph node dissection does lead to an increase in complications. This is why in the EAU guidelines in 2024, just updated recently, pelvic lymph node dissection has been greatly downgraded in all of the recommendations. In intermediate risk prostate cancer, it's almost completely removed from the guidelines. No mention of nomograms, nothing. It's just a blank space. And even in high risk prostate cancer, where it used to say extended pelvic lymph node dissection must be performed, now it says, well, if you're going to do a lymph node dissection, make sure it's extended. So the emphasis is coming right off. And that's not even taking into account PSMA PET CT. But as I argued at the EAU, novel nomograms using PSMA PET from our friends in Milan, led by Alberto Briganti, are showing the extremely high negative predictive value for intermediate risk disease. And even for high risk disease, it's very tiny areas of prostate cancer that we're missing. And there's no data to show that identifying those through an extended pelvic lymph node dissection improves survival. So my very clear message, which not everyone will agree with in both these recent large meetings, is that if a patient has a negative PSMA PET CT, we do not recommend extended pelvic lymph node dissection. And that's been practiced here in Australia for very many years now.